Welcome back to the David Pakman Show. Joining me is Steve Siebold, author of Sex, Politics, Religion, How Delusional Thinking is Destroying America. Steve, great to have you. You make the case in the book that a lack of just basic critical thinking about some of the foremost political issues is really driving us in the wrong direction, particularly with the politicization of a lot of these issues. Let's go through a couple of these one by one if we can, and just kind of see where you think the critical thinking direction will get us on these. I want to start with healthcare reform, which we're actually awaiting a Supreme Court decision on.
Yeah, absolutely. I mean, well, the idea here is that the delusional thinking is we actually have the money to pay for this crazy law, and we don't. Obviously, we're broke, and to have 32 million people uninsured and then insure everyone in the country, force everyone to be insured to cover these 32 million, many of which are really young people, is ridiculous. I mean, and even if it wasn't ridiculous, we don't have the money. We're broke. And we're going to bankrupt our grandkids with this kind of thing. Hopefully the Supreme Court will come back and rule against it.
See, I can understand why individually you would come to some of those conclusions, but the problem is, okay, let's take a look at the insuring young people thing. If we don't insure young people when they're healthy, then they're not going to be able to get insurance from health insurance companies once they do get sick, and inevitably people do get sick. So do you, if that is your point of view, do you believe we should just have a national government healthcare system like they do in many countries in Europe, or are you going the other way, kind of the Republican way of saying we should have a completely free market-based system?
Absolutely, free market-based system, more of a libertarian point of view, I think, than even Republican. But yeah, definitely more toward that. And if we're gonna hit the 32 million, let's hit the 32 million instead of 332 million. I mean, it makes no sense. Even if we could afford it, it's obviously socialized medicine, and it just really reflects the views of the Obama administration. I mean, it's obviously a socialist leaning, at least, organization or administration. I mean.
So but you said we're putting 32 million people into the for-profit healthcare system, which is mostly the result of corporate funding and corporate influence. What's socialist about that?
Well, I think the biggest issue here is that nobody. This is one of the delusions that I talk about in the book. Is that no one in this country is denied health care. They never have been denied health care. They never will be. If you walk into a hospital off the street and you have no money, you will be treated.
No, that's not true. Well, hold on a second. Let's think critically, because I know that that's your thing. There are laws indicating that the patient has to be stabilized. Okay, that's legally all that has to happen. That doesn't mean that you are going to get cancer treatment, for example. It just means legally the hospital has to stabilize you and or transfer you somewhere where you can be stabilized. But that doesn't mean that you're going to get treatment. But I want to go back to what you said. What's socialist about putting 32 million people at the mercy of for-profit health insurance companies, an additional 32 million people?
Well, it's socialist if it's welfare. I mean, if it's socialized medicine, it's socialist. I mean, it's a socialist philosophy or policy.
But Steve, hold on a second. You're the critical thinking guy. You're defining something as socialist by saying it's socialized medicine. You can't define something. The definition for something can't be that which we are defining. What is socialist about putting 32 million people into the for-profit healthcare system and letting companies with profit as their motive decide whether they should or shouldn't have treatments approved, co-pays, etc.? What's socialist about that?
Well, that's not. You're going the other way. If you're putting them into the system we have currently, it's not, and that's where they are now.
That's what we're doing.
Well, no, but if Obamacare is going to mandate, I mean, they're going to have to buy insurance. I mean,
yes, for-profit insurance from the for-profit companies. What's socialist about that?
It's socialist because it's mandated. It's mandated by the government. That's socialist by definition. I mean, it's mandated by the government. You are forced to buy a product, and it's unconstitutional.
So the Republicans who first came up with the individual mandate idea in the early 90s, they're socialist.
Well, that's a sweeping generalization. I wouldn't go that far, but I mean, I think.
But Obama's socialist when he does it.
Well, no. I think I'm not saying they're socialists. I'm saying they're socialists.
Well, you did say that, Steve. That's the thing. I have a problem with the socialism claims because many people like to say this is socialist, and when you ask them about it, they do what you're doing. They say socialism is socialist, or they equivocate. So when I'm thinking critically about it, I have a real problem with it.
Well, yeah. Okay. Let me explain. Okay.
Let's
I understand.
back up. Yeah.
Okay. Yeah. We have socialized medicine in this country, and Medicaid is socialized medicine. Medicare is partially socialized medicine. I mean,
Correct.
Social Security is a socialist program. It's welfare. It's not welfare, but it's government. It's government funded to some degree.
You pay
So,
into it, and then you get money back.
Yeah, exactly. So I mean, it's not like we're not totally doing this. What I'm saying is that for the government to come along and mandate that we buy a product, that's so. I'm not saying Obama or the administration they're socialists.
Oh, you're not saying that, because I could have sworn you did.
They're leaning. I said social. They're leaning toward a socialist philosophy. I mean, you could.
Okay.
That's a pretty big statement to make that they're socialists, but I think
it was. I was surprised you made it. Yeah.
Well, yeah. Well, I said leaning. I think I said leaning. I think they lean toward that.
Okay.
But Obamacare, to me, is a completely socialist program. I mean, it's a government mandate of a product. It's un-American. It's unconstitutional. And I think David, when I think by Thursday we're going to get a decision by the Supreme Court, and I think they're going to go against it. I'm pretty sure. I don't know how they can't.
Yeah. Because I want to get to other topics, we'll agree to kind of drop it. But again, I would go back to the same question. What's socialist about putting 32 million more people into a for-profit health insurance mandated by corporations? Let's talk about gay marriage. What's our critical thinking analysis of gay marriage?
Well, that it's not discrimination to keep gays from being, from allowing them to be married, and it's not. It's obviously a religious thing. It's from the religious right. They've been going after people. I mean, they've discriminated against almost every group. I mean, women. I mean, the religious right has gone against women. They've gone against minorities. They've gone. I mean, it's just ridiculous. And gay marriage is going to be passed in this country, Dave. There's no question, because it's the right thing to do. It's just a matter of time. All these Bible thumpers are going to lose eventually because it's wrong. It's outdated. It's antiquated. They need to grow up emotionally and let people be who they want to be.
See, Steve, I was surprised about our disagreement on healthcare reform because you're so spot on with the gay marriage issue. I mean, there's no question, inevitably, this is a fight that's going to be lost. And it is, you're right, being directed mostly by the religious right. Since we agree on that one, let me fit one more topic in. Death penalty. Give me your thoughts.
Well, I think the death penalty is a really controversial issue. I really think, I mean, there are studies that show that it's not really effective. I mean, there are really some conflicting studies on this. I struggled with this one in the book, honestly. I think that the death penalty should be enforced, and we should have it. But at the same time, a lot of studies show that it's not really effective in deterring crime. So that's really a tough one. I'm not against the death penalty, but I think that, again, it's more of the religious right infringing on policy, on public policy.
So you believe that it's perfectly legitimate for the state to sanction the killing of people based on a list of crimes the state itself has determined to be worthy enough of death as the punishment? You believe the state?
Yeah.
But I thought you were very libertarian.
Well, it's a tough one. It's a tough issue. I've really studied a lot, and it's a tough one. But yeah, I think so, because I think it does determine people. I mean, deter people. I mean, to from committing capital offenses, and although some studies show against it, it's a tough one.
Because at the beginning you said you don't think that it's a very good deterrent. I mean, what about the fact that, forget about whether, let's skip whether the state should have the right to make those decisions about taking life from others. What about the fact that, like, for example, we just found out that in Texas an innocent man was put to death? What about the finality of it, the lack of being able to provide someone remuneration for wrong imprisonment or incorrect punishment? Once you kill them, you can't do that.
Yeah, I know, and a lot of people make that case. And I mean, and I think that there have been very few cases that have turned out that way. I mean, of all the people that have been put to death, I mean, I don't think there have been too many mistakes, but you're right. I mean, even if there's a mistake made on one person, that is one of the issues. I don't think that should hold us back. I mean, I hate to say it that way, but I think that's reality.
All right. 1 out of 3 is not bad, I guess, on the 3 topics we got to. The book is Sex, Politics, Religion. It's by Steve Siebold. Even if we don't agree, I thought the book was very compelling and an interesting read. So thanks for being on today.
Hey, thanks, David. I appreciate it.